Well, coronary angioplasty is a treatment performed by interventional cardiologists. That's to say they're heart specialists who have learnt the skills to manage arteries that are narrowed by using techniques which involve just a very small puncture in the skin and inserting just a small tube into an artery. And in simplistic terms, it's taking a narrowing or a complete blockage of an artery, opening that, dilating up that narrowing, and then treating it almost all the time these days by inserting a little device called a stent, which is, think of it as a small metal coil or spring. And so the actual basic procedure involves getting access into the circulation, that's into an artery, and then inserting a tube that we call a guide catheter that passes from the point of access up to the artery, up to the coronary artery, which is one of the arteries that supplies the heart with blood, and then passing a very fine wire down the artery, which enables us to use that as a track, to then usually pass a balloon, which then we inflate to dilate up the narrowing, and then we decide what sort of stent or stents that we need to put in, and then that opens the artery up, keeps it fully held open, and so where there was a narrowing, there's no longer a narrowing, and so the blood can flow and therefore hopefully relieve the symptoms that the patient has.